Welcome, and thank you for joining us for this learning session and for engaging with us throughout National Prevention Week. Each year, SAMHSA joins with partners around the country during the second week of May to celebrate the possibilities and the brighter future that prevention brings us and the ongoing work that we do together. We have a wonderful opportunity today and really throughout the rest of this week, not only to uplift and showcase the tireless work that you do every single day in your communities, but also to come together and learn from each other, share our experiences and successes, and share the good news of prevention. While we know prevention is a lot of work, and everyone that you hear from today would not say otherwise, we also, I think, share in saying that there is a lot to celebrate in the work that we do, and this work doesn't happen alone or without you working together. For those of you who are new to Prevention Week, the annual observance first took place in 2012, so we are coming up on the 25th year here. Maybe for the 25th year, we'll bring back some of those old videos to show how prevention has really evolved, and National Prevention Week has evolved along with that trajectory of the changing landscape in substance use prevention and how we do our work. Speaking of how we do our work, for SAMHSA, we have Communities Talk to prevent alcohol and drug misuse. And we also have Talk to Hear You. These are two of SAMHSA's most prolific national youth substance use prevention initiatives. And today you're going to hear from both leaders and from community partners, and maybe some rising young prevention rock stars as well, who are forging paths to prevent the initiation of substance use, the progression of substance use, and to prevent its related harms. I'm delighted to be here with you today and with the teams who you're going to hear from very soon, who are going to share resources with you about what they're doing in their community, but also that you can share with your community partners, with your universities, with your schools, with your parents and caregivers, and really all of your community stakeholders who are committed to preventing substance use and building more resilient communities. Today's webinar is recorded, as you saw. It's going to be posted to SAMHSA's YouTube channel in the next week or so for on-demand viewing. As soon as you see that posted, please do share it within your communities and be the first ones to say, hey, look what we did. We'll also be using the chat feature throughout the webinar today. So if you have questions as we go, you don't have to hold those questions. You can put them in the Q&A in the chat. We'll address those at the end of the session, though, for that Q&A. And now it's my pleasure to introduce to you a colleague, Crystal Board, who is going to be our first speaker. She's the Vice President and the Diversity, Equity, and Inclusion Practice Lead at Vanguard Communications. Crystal?
Hi, thank you so much, Sarah, and thank you so much for joining us from the Center of Substance Use Prevention at SAMHSA and for starting this really exciting conversation we're having today. So as Sarah mentioned, my name is Crystal Board. I'm a Vice President at Vanguard Communications, and we provide strategic support to the Substance Use Disorders Prevention Engagement Initiatives, or otherwise known as SUDPI. And the Communities Talk to Prevent Alcohol and Other Drug Misuse Initiative, or Communities Talk, is a part of SUDPI. And I'm going to be telling you a little bit more about this really impactful initiative. So what is Communities Talk? So Communities Talk is a SAMHSA program to support community-based organizations, probably like one that you represent, to hold prevention events and activities in your community or in your state. That includes colleges and universities, local coalitions, state-based organizations, and local chapters of national organizations. Examples of what we are hoping that Communities Talk events can do is to raise awareness and educate communities about the harmful consequences of underage drinking, as well as misuse of other substances among individuals 12 to 25 years old. and to help mobilize communities to take evidence-based prevention actions. And we're hoping that some of the communities and organizations that are joining us today to share some of their lessons learned and the work that they're doing in the community will show new and inspire new ways to mobilize your community as well. Since Communities Talk began, it supported thousands of local organizations' prevention events by providing $750 planning stipends. Communities Talk has evolved and now takes place every year. This year's cycle actually began in January 2024. We hope this change will help communities carry the momentum in their prevention efforts from year to year. We also encourage organizations to continue their prevention work, even if they do not receive a stipend. So there's always an opportunity to connect Communities Talk into the work that you're doing with your community-based organizations. So how can you get involved? How can you participate? So registration for the 2024 cycle of Communities Talk is open right now, and there's still stipends available. So I recommend going to the website and finding out about how you can apply for a stipend as soon as possible. You can request an invitation from this email address. It's info@stopalcoholabuse.net. And if you email that email address, you will get information of how you can get invited to submit a request for a stipend. And just to note, planning stipends are available on a first come, first served basis. Once you're invited, though, you'll need to complete an online registration form. And there's lots of information and instructions about how to do this at stopalcoholabuse.gov/communities talk. And on that site, you can learn more about registering and and ideas for planning your activity. And we would love to feature your activity on the Find an Activity map that is also on that website. So make sure to update the activity details in your Communities Talk profile as you plan your events. And keep an eye out for an invitation to share your own Communities Talk success story. Your story could be featured on the Communities Talk website, so you don't want to miss that opportunity too. So there are lots of resources that we've made available on the Communities Talk website to help support your planning work and the implementation of your Communities Talk event. We have resources such as our prevention podcast series, which features participants from previous Communities Talk cycles, sharing their success stories and lessons learned. And that's available on the website, as well as other streaming platforms where you download podcasts. We also have some customizable resources such as tips and tools on various topics, including how to engage the news media, how to use social media as part of your event, and event introduction, as well as graphics. So lots of great resources. So recommend you visiting stopalcoholabuse.gov/communities talk to learn more. And then, sign up for What's New articles that help event organizers plan, host, and evaluate their prevention events around Communities Talk. And, bookmark the Communities Talks page for the latest news related to the initiative. And there's lots of new content that's being added there all the time. And engage with us on social media using the hashtag Communities Talk. It's a great way of adding what you're doing into our national conversation around substance use prevention. And so please, as you're promoting your events, add that hashtag to it so we can all get to see it and participate. To see all of this and more, visit the Communities Talk website. So now I'd like to turn it over to a colleague to talk about another SAMHSA initiative, another SAMHSA program, and how you can get involved. So I'd like to welcome Caitlin Conrad. Caitlin is a senior communications specialist at Synergy Enterprises and supports the Talk They Hear You campaign. So I'll turn it over to Caitlin. Welcome, Caitlin.
Thank you so much. Hello, everyone. As mentioned, my name is Caitlin, and I am a communication specialist, and I do work on the Talk They Hear You campaign, and I'm excited to give you all a brief overview of our campaign and the tools and resources that are available. Next slide, please. The alcohol-related disease impact application estimates that each year there are more than 178,000 deaths attributable to excessive alcohol use, making alcohol one of the leading preventable causes of death in the United States, right behind tobacco, poor diet, physical inactivity, and illegal drugs. As part of the work of the Interagency Coordinating Committee for the Prevention of Underage Drinking, also known as ICPUD, the Talk They Hear You is part of the federally coordinated approach to address prevention of underage drinking and other substance use by helping parents, caregivers, schools, and educators and community members get informed, be prepared, and take action. Under ICPUD's leadership, SAMHSA's Center for Substance Abuse Prevention developed the Talk They Hear You campaign in response to the directives set forth in the STOP Act. The Talk They Hear You campaign was launched in 2013, and we just celebrated our 10-year anniversary. Next slide, please. A little bit more about the campaign itself. There are 3 primary objectives of the campaign, and it aims to help parents, caregivers, educators, and community members get informed by increasing their awareness of the prevalence and risks of underage drinking and other substance use, be prepared by equipping them with the knowledge and skills and confidence to prevent or reduce underage drinking and other substance use, and take action by encouraging and increasing their actions to prevent and reduce underage drinking and other substance use. Next slide, please. The Talk They Hear You campaign has an impressive catalog of more than 500 products to choose from. There are TV, print, and radio PSAs, and we have 15, 30-second PSAs available for download. We have fact sheets, brochures, pop-up banners, campaign implementation and event planning guides, discussion starter guides and videos, soundtracks. We have a great podcast called What Parents Are Saying. And we also have skill building and early intervention resources, including the mobile application of Screen for Success, which is our new screening tool to help you or someone you care about quickly identify areas where someone may benefit from more support. It also provides local and national resources to help address any concerns identified. We also have Parents Night Out, which is our educational sessions that inform parents and caregivers about the realities of underage drinking and other drug use. It prepares them to talk with their children about these issues and motivates them to start having really important conversations. And then we also have a student's assistance guide for school administrators and student's assistance 5-part webinar series to help student assistant professionals support the needs of the students who may be struggling with substance use, mental health, or school-related issues. And we have lots of materials that are in the pipeline. Specifically, we are focusing on intervention resources for educators and parents. And these products are in development, but stay connected with us to receive updates and more information. Next slide. If you're interested in learning more, we would love for you to connect with us. We have several ways in which you can do that. So you can check out our social media pages, subscribe to our newsletter, check out our website, or even email us for more information. So next, we're going to learn about how our campaign partners are using the Talk They Hear You campaign products in their communities. So with that, I'm going to turn it back over to Crystal to introduce our next speaker. Thank you.
Great. Thanks so much, Caitlin. More and more great, wonderful resources that you can access on the web to help support your prevention work in your communities. So now, as Caitlin mentioned, we're going to hear from our community speakers who have done and continue to do amazing prevention work in their communities. And we're so honored that they're joining us today. First, I'd like to introduce Dr. Talia Puzantian, who is a professor of clinical sciences at Keck Graduate Institute School of Pharmacy in Claremont, California, and is a board-certified psychiatric pharmacist with over 30 years of experience in teaching, research, and clinical practice. Talia's research interests are focused on pharmacists' roles in mitigating the opioid crisis, substance use and mental health prevention efforts in adolescent and young adult populations. Welcome, Talia.
So much, Crystal. Good afternoon, everyone, and thank you for being here today. I appreciate the very kind invitation from SAMHSA for this opportunity to meet with others engaged in prevention efforts and share our experiences and to be part of this National Prevention Week. Yesterday, I attended the kickoff celebration webinar, and it was so inspirational hearing from others doing similar things, but in different ways. And I was really particularly thrilled to hear through the FENT-Alert announcement of winners about the creative prevention efforts that adolescents in our communities are engaged in. It's really inspirational. And as Crystal mentioned, I am faculty at Keck Graduate Institute, which is part of the Claremont Colleges. So next slide, please. The Claremont Colleges, I'll tell you a little bit about the Claremont Colleges. These are 7 independent private institutions of higher education that collaborate as a consortium. And we include 5 undergraduate liberal arts colleges and 2 graduate institutions. You can see the schools here on the slide. Keck Graduate Institute is one of the 2 graduate institutions. We're located on contiguous campuses in the beautiful city of Claremont, California, which is on the eastern edge of Los Angeles County. Each institution has its own student body, its own faculty, its own emphasis on curriculum, and its own culture, just really an overall vibe. Each one is very distinct. But the consortium, this inter-campus kind of cooperation that we have, helps us to provide university scale services to our collective 8,500 students who are spread across these 7 campuses. Next slide. Thank you. Shortly after I joined KGI, which was at the beginning of 2016, I was asked to assemble and to chair a campus mental health and wellness committee. And through this committee's work and under a SAMHSA-funded Garrett Lee Smith suicide prevention grant, we at the Claremont Colleges undertook the 4-year initiative called the JED Campus Program. Some of you from institutions of higher ed may be familiar with this, and actually now in high schools too. The JED Campus Program is a multidisciplinary, collaborative, systematic process that engages everyone on campus, students, faculty, leaders, and staff from all the different divisions, student affairs, campus safety, student health services, counseling services, athletics, residential, and really a wider range of all stakeholders across our campuses to really critically assess existing programs and policies, and then to enhance and build on our mental health, substance use, and suicide prevention efforts. And you can see here in the graphic wheel from JED how truly comprehensive and collaborative this effort is. And, you know, as luck would have it, we completed this intense 4-year initiative in early March of 2020. And if all of you probably remember what else happened in early March of 2020, needless to say, we felt very prepared, or as prepared as we could feel going into the COVID pandemic and all of the challenges on our students' wellness that came with that. So in the fall of 2021, when we were finally welcoming everyone back to being in person on campus, back to what we thought would just be, you know, business as usual, our student affairs leaders planned a block party and called it Back to Your Future. Next slide. Thank you. And this Back to Your Future event is where we've implemented our Communities Talk efforts. And that's what I'll be sharing with you today. This block party, hosted by the Claremont College's Student Affairs Services, was originally conceived, as I mentioned, to be a welcome back from the pandemic. One-time event, but really it was so successful in that fall of 2021 that we've been hosting it annually since then. And our most recent event was this past September. And its purpose is to connect students to the full spectrum of services and resources that are available to our students while they're attending one of the Claremont Colleges. It takes place central to all of the campuses near our shared library along the beautiful tree-lined streets. You can see some of the pictures here. There's a block party vibe with students are, you know, strolling, meeting with friends, eating, free food, which, you know, for college students is a major plus, listening to music, participating in games and crafts and activities. And of course, prizes add to the festive event too. And you can see the school mascots, they're there strolling the streets too. You can see one of them there with the DJ. And of course, the booths, the various college offices and services, as well as city resources, local vendors, all host the over 50 booths at the event, providing information and resources to our students. From the college side, we have campus safety, campus bookstore, the rec center, student health services, counseling center, student accessibility, each hosting a booth. The chaplains, various student affinity groups like our Chicano Latino Student Affairs, our Office of Black Student Affairs, Queer Resource Center, they're all hosting booths as well. We have a flu shot clinic. It's that time of year when everybody's coming back and living in close quarters. We have a blood drive, HIV testing and counseling truck, and an area with pets for petting, which, as you can imagine, is a big hit. And over 500 students attend. It's just a real feel-good event, and the response from the students has been overwhelmingly positive and a really great way to kick off a new academic year. Next slide, please. Another one of the booths is our KGI, Keck Graduate Institute School of Pharmacy Substance Use Awareness booth that we host in conjunction with SAMHSA's Communities Talk program. These pictures are from our most recent event in September of 2023. We have been incorporating Communities Talk into this event since the first one in 2021, but I'm going to describe the most recent event and later share some of the challenges and lessons learned along the way over those 3 years. I'm really fortunate to have eager and committed pharmacy students on our campus. I recruit and train those students that are interested in substance use prevention work and interested in doing community service outreach. We meet and together we review our resources. Some of our resources are freely available from SAMHSA and NIDA, some of which were highlighted here, but there are lots of others. They're really excellent. Some of the resources we've developed ourselves, and we update every year as needed. We, together with my volunteers, we discuss our goals, our messaging, and we review, sort of best practices on how to effectively communicate with other students. And at this particular event, 2023, you can see in the picture, we had about 12 PharmD students, and several of these students had just started our program just a couple of weeks before. So they didn't have any pharmacy experience yet. This would be similar to having undergraduate students volunteering as they really hadn't begun the program yet. But our goal overall is to be a peer-driven resource to students by having students talk directly to other students to provide information, increase awareness around substance use related issues. And in keeping with SAMHSA's goals, in our approach, we advocate for preventing the initiation of drug use, but we also, target preventing progression of drug use and also in preventing the harms related to substance use. And I can tell you that we see students all along the spectrum in terms of their knowledge and their experience with drug use, kind of where they're at. We've had an 18-year-old tiny female of Asian descent who was a freshman, new to leaving home, was just landing on campus. And she very shyly told us that she had never had any alcohol, but knew that she'd be going to parties and wanted to try alcohol, but wanted to have some information first about how would she know how much would be okay to drink. And on the other end of things, we had a student who let us know that they had announced to their dorm floor and their roommates that they had naloxone and fentanyl test strips in their room should any of their peers want or need them at any time. Another student that we talked with at our booth told us that he had come from a high school in Missouri that had experienced several overdose deaths during his time there as a high school student. So really, and as you can imagine, our student volunteers were met with a wide range of attitudes and knowledge and questions from the attending students there. And the way we run our booth is that students can just chat about whatever's on their mind with one of our peer volunteers who make themselves more approachable by standing in front of the booth rather than behind the table. And if they don't have something specific on their mind, then the peer volunteer encourages them to spin our colorful Wheel of Fortune type of spinning wheel that we have. It's numbered from 1 to 14, and each number corresponds to a different, distinct question. And the topics for these 14 questions include information from binge drinking, general information about alcohol, misuse of prescription stimulants, counterfeit pills, sedative use, hallucinogen use, e-cigarettes. We have several topics covering polysubstance use, mixing substances, combining alcohol with prescription stimulants, combining alcohol with other stimulants like cocaine, combining alcohol with Xanax or other sedatives. Combining alcohol and cannabis is something that students often want to know about and need to know about. We also have general information about cannabis with emphasis on potency and routes of ingestion like edibles and vaping, and how the risks associated with each are different. And of course, a couple of questions about overdose and naloxone as well. And the volunteer will ask the participants the question corresponding to the number that they spun on the wheel to see if they know the answer, and to just help begin a conversation. Sometimes the student participant might want to talk about something else, but the wheel spinning helps to engage them and helps them to expand the opportunity for possibly a different conversation. And with our signage there, our Communities Talk signage, our flyers, we provide a QR code that the students can scan, and this directs them to a PDF that they can download that has all of the 14 questions with their corresponding answers, and they can review that on their own and share that with others too if they want to. We also provide overdose education and naloxone distribution at this booth. Our volunteers will ask students if they know what naloxone is, if they know about overdose. Then they will train students who are interested on preventing, recognizing and responding to overdose, and instruct them on the proper use of naloxone, and giving them a 2-pack of nasal spray, along with a trifold pamphlet that we've designed to be kept with the doses. And the trifold summarizes the information that the volunteer has relayed to them, because the students will forget by the time with everything else going on at this event. And the trifold also has a QR code which sends them to an 11-minute video that comes from the California Department of Public Health that is about overdose and naloxone, and really well done video. And so we urge them to share that with their roommates and make their roommates aware where the naloxone is being stored, and get trained themselves by watching that video. So in terms of outcomes from our Communities Talk efforts, at the September 2023 Back to Your Future event, we had over 300 students who stopped by our booth over those 3 hours of the event. We distributed 256 boxes of naloxone, so 512 doses. And we have yet another QR code that's on a sticker on the naloxone boxes with instructions that they should scan it if the dose is used. And it provides an anonymous way to answer a yes/no question. Was this dose used? And that helps us to keep track from our distribution events when doses are used. But we have distribution events throughout Southern California, and we've distributed thousands of doses in the last year. So it's impossible for us to know as an objective outcome if the doses that were marked as used were distributed at this particular Communities Talk Back to Your Future event. Subjectively speaking, though, I can say that the impact of this event has been overwhelmingly positive. Student feedback that we collect after the event has relayed to us that they feel supported and cared for by the school for providing both information about substance use and also for distributing the naloxone doses. And since this is a peer-to-peer approach, there's also the impact, a very positive impact on the volunteers that can't be overlooked. Our student volunteers are sometimes, understandably apprehensive at the beginning. They're unsure if they know enough to have these conversations with other students. But generally, a few minutes in and feeling the response that they get, gratitude from attendees, making connections with those fellow students and sharing information and support, the volunteer peer educators are also clearly benefiting from this as well. And it's not unusual for my volunteers to ask me, when's the next outreach event going to be? So next slide. Speaking of additional events, our Communities Talk Back to Your Future events have been a great catalyst for other events. Given the overwhelmingly positive response from both attendees and volunteers, we've expanded beyond this event. Following this most recent Back to Your Future event later in the fall semester, several campus groups asked us to train them for overdose and naloxone. We have health education outreach on our campuses. This is a group that provides safer sex supplies, HIV pregnancy testing and counseling, stress reduction, and so forth. And they've now added overdose and naloxone training after we provided them with a Train the Trainer session. Student Affairs has asked us to train our campus peer mentors. Student Affairs also asked us to train their staff for overdose and naloxone. The Claremont colleges collectively hosted a National Public Health Week in April for all 7 campuses with a different topic being highlighted each day. And for one of the days, we hosted our overdose naloxone training booth. And Fresh Check Day, some of you in higher ed are maybe familiar with this. This is a nationally known mental health and wellness fair specifically for college campuses and really targeting prevention, suicide prevention, and just mental health wellness overall. And that event is designed with peer-to-peer interactive booths, so similar to what we do at our Back to Your Future event, but these focus on self-care, stress reduction, gratitude, connection, and suicide prevention. And we were invited by one of our sister campuses to host an overdose and naloxone booth at their Fresh Check event this spring, just a few weeks ago. And we've also connected last year and this year with local high schools to provide prevention training to high school students who then become peer trainers at their high school. And we're looking now at further expanding our outreach to transition age youth who are not attending college, because that's an important group to hear our messaging as well, our prevention efforts. And especially given the recent data on the rise in adolescent and young adult overdose deaths, a recent paper in New England Journal in January talking about 22 high school kids dying every week from an overdose. That's the equivalent of a high school class every week. And the lack of awareness by this age group and the college age group regarding overdose and naloxone. There was a paper just published a couple of weeks ago in JAMA Peds with only 14% of the thousands of college students surveyed in the Healthy Mind study knew how to administer naloxone. There's still a big need for this kind of outreach and prevention work. So I tip my hat to all of you doing this on a daily basis. And my group of young adult student volunteers are especially motivated to continue to provide greater awareness and as well as naloxone access to this age group in particular. Next slide, I want to reflect on and share the challenges we experienced and the lessons we learned along the way. My proposal for a substance use awareness booth was met initially with some hesitation and reluctance, not quite opposition, but some fears and concerns from administration leaders on our campuses, and also from campus safety, particularly since it would be a peer-to-peer kind of structure. What would be the messaging they wanted to know? The moral hazard argument that often comes up in harm reduction efforts. Would we be facilitating more substance use in these students? Since they would have naloxone on hand? Would campus safety be notified if there were an overdose, or would they be bypassed if the students had naloxone on hand? So these concerns led to a series of very important discussions that we aimed at educating our campus leaders about the impact of substance use prevention efforts and advocating for the importance of harm reduction efforts. And it was really important to have their support. And we made sure we clearly communicated our goals, our messaging with campus administration. We shared our resource materials with them so they could see exactly what we would be telling students. We collaborated with campus safety to work in parallel with them so that they were aware that students were being trained by us to call campus safety in the case of an overdose. At National Public Health Week, campus safety joined us at our booth and had a presence there. We collaborated with student health services and counseling services to help us in developing our messaging. We asked them what's appropriate and timely in this population based on what they're hearing and seeing in their clinics there. And they had great input that helped us drive what content we would focus on. So another challenge, really, the fact that there's a wide range of students with regard to substance use knowledge and attitudes, that posed a challenge in our volunteers who needed to be able to assess this in each interaction that they had, and they needed to be able to deliver their messaging accordingly in order to connect effectively with each student each time. So we trained our students so that they could connect within that full range of student experience. And the use of peer volunteers itself is a challenge in that they might have their own misconceptions or misinformation about substance use. So training truly is key. We used very targeted training by boiling down the messaging to those 14 topics. We also made sure that our first-time volunteers sort of shadowed a more seasoned volunteer for at least the first few interactions. We also trained our peer volunteers to be targeted in connecting with their audience. What did they want to know specifically? To not overwhelm them with too much information or trying to cover all 14 topics. By using that QR code to share our materials with the attendees, we could prevent overwhelming them with too much messaging in just those few minutes we had with them at the booth. And then lastly, another challenge is how do we track success? It's difficult to give you objective measures, as I said, of our success or outcomes, as we weren't set up to do so for this event, but we listened to subjective feedback each year and we adjusted accordingly. For example, the first year we were just returning from COVID and I ran the booth on my own. I wasn't set up with volunteers yet after being remote for so long. It went well, but it wasn't ideal. For the students, it probably felt like talking to their mom about, smoking weed, which may be fine for some students, but, unthinkable for some others. So the peer-to-peer element adds an important aspect to this effort. So starting in 2022, we brought in the peer volunteers. Also in 2022, we were talking about overdose and naloxone, but we didn't have any doses to give out. Instead, we were letting participants know how and where they could get naloxone themselves off campus. And it was clear that there was interest from students in having doses on hand. So we set ourselves up as a naloxone distribution program through a program with the California Department of Healthcare Services that provides us with free doses of naloxone that we can distribute at events like this. So to summarize, my tips are that it takes a village, as they say, use partnerships that already exist. I was able to tap into our existing committee work for mental health and wellness to add this substance use prevention initiative to the work we were already doing. We used existing resources, content resources from SAMHSA and NIDA, but we also developed some of our own resources to target specific topics or messages that were important to us that we wanted to incorporate for our target population as we identify the needs of our students. So yes, target your messaging. What is going to land best with your population? For our college campus population, our target focus has been binge drinking, combining alcohol with THC, misuse of prescription stimulants, and of course, counterfeit pills, overdose, and naloxone. And your messaging will change over time, so be ready and able to modify and update as needed. And just finally, collaborate with others, talk with others doing similar work. A big shout out and thank you to SAMHSA's National Prevention Week for making this type of networking possible. Prioritize what you'll do because invariably you can't do it all. Get and listen to feedback, even if it's subjective, and grow from that feedback and grow into new opportunities as they present themselves. And next and final slide, I will wrap up there and I welcome during the Q&A period any questions you may have and also invite you to tell us about successes in your own prevention work. So thank you and I'll turn it back over to Crystal.
Thank you so much, Talia. That was fantastic. Lots and lots of really great ideas and suggestions for that can be applied in other communities. So thank you so much for sharing that. And as Talia mentioned, we are going to have a Q&A section towards the end of the presentation that will include all of our community speakers. So if you should have a question, go ahead and put it in the chat and we will get to it during the Q&A session. All right, so now I'd like to turn it to another community who's joining us today. And this one from Oregon. Tigard Turns the Tide has promoted a safe and healthy Tigard for more than 30 years. And today we're joined by Connie Ramakers, who is a health promotion specialist. And she's joined by two student leaders, Brooke and Mateo. Welcome, all of you. And Connie, I'll turn it over to you.
Thank you so much, Crystal. I just want to give a big shout out to both SAMHSA and Talk They Hear You. We've been partners for several years now, and the materials, the stipends, the grants that we've applied for is what has helped to make Tigard Turns the Tide a big success. And so this is Brooke and Mateo, and you're going to be hearing from them very shortly. But I wanted to begin by giving you just a quick history of Tigard Turns the Tide. We've been around for many, many years. And we're a community organization that began in 1982. And we began because we had some parents very concerned about the drug use that was happening within our community. And also we wanted to start and put on a drug and alcohol free grad party. And we were one of the very first in the state of Oregon and throughout the nation to do that. As we progressed, we became a 501c3 in 1989. And then from 2007 to 2016, we were Drug Free Communities grant recipient, which was wonderful. And then from 2016 to 2021, we also received a STOP grant through SAMHSA. And then in 2021, we became a licensed partner with Talk They Hear You. And the materials that we use through Communities Talk and through Talk They Hear You, I can't express how valuable that's really been. In 2023, we applied for a Partnership for Success grant with Tualatin Together to implement Communities That Care. Next slide, please. So here our community came together. So at the beginning of this year, I stepped down as the executive director. And there in the middle, you see me with Sunshine, Navarro Shively. She is our new executive director and is just going great guns. This was a community breakfast that we had where we brought our board members and community members together to introduce Communities That Care. And so that's what we're in the process of actually, implementing that process. And I just can't again say enough about our many community partners and especially our board members that are so extremely valuable to the success of Tigard Turns the Tide. Next slide. So I also wanted to just highlight STUD because both Brooke and Mateo are here from STUD, and we have been around since 1987. I took a group of students to a national prevention conference in Sun River, Oregon, and that's where we got our start. We had a meeting. We became known as POWER, Promoters of Wellness, Entertainment, and Recreation. And then in 1995, we rebranded and became part of a statewide organization called AWESOME, Oregon Students Safety on the Move. And then in 2007 is when we actually branded ourselves as STUD, Stop Tigard Underage Drinking and Drugs. And then because I think that's missing. But then in 2018, we joined the Heron Project, which also is very instrumental in helping us with activities and events that we put on throughout the year. We are getting ready. In fact, this week, we are actually celebrating the National Mental Health Wellness Month. And along with that, the Prevention Week, we did a big rock painting event that was very successful. And we are going to take those rocks and we're actually going to distribute them throughout the community and throughout our school. And then tomorrow, we're doing a big event where it's called the Mental Health Hope Rally, where the county has provided these signs for us. And the kids stand outside the high school and wave the signs, and they say, like, you've got this, you're enough, you matter, one day at a time, both in English and Spanish. And we've been doing that now. This is, I think, our 3rd year, and it's just a lot of fun for the kids, but the community really loves it as well. So what we wanted to do today, and that's what I'm going to turn the time over to Brooke and Mateo here shortly. We did a very successful event this year called Raising Voices, Saving Lives. And it was a big forum that we just had on April the 10th. And so with that, I'm going to, I think Brooke's going to be the first, so I'm going to turn the time over to her. Next slide, please.
So at the beginning of our year in STUD, we had a leadership meeting with all of the people who had been members of STUD for a couple of years now. And we decided that our co-presidents would be Alyssa Gilliott and Ephraim Wosley. Next slide, please. To start off the year, we did this meeting at the beginning of school, and we meet twice a month during the school year. We also did a TTSD school board presentation, which kicked off Red Ribbon Week. Then we did the National Red Ribbon Week campaign, where we did a lot of things at our school with the students and stuff. And we visited the elementary school classrooms during this week, and we had them learn about how to make healthy decisions in their lives. And then during the Christmas time, we did a holiday party, and it was just kind of a get together and a celebration of what we had been accomplishing that year so far. And then the week after we got back, we had National Kindness Week.
And kind of going off of what Brooke said, we had a presentation that we gave to the City Council of Tigard, where our students from STUD kind of just went to City Council and presented what STUD is all about. And like Connie said, we are also participating in National Mental Health Awareness Month, and we do a lot of activities for that. We also have a yearly community talk event where we promote Talk They Hear You, which is where we try and reach out to the parents and encourage them to talk with their kids about drug use and being safe with drugs. And like Connie also said, we're also participating in National Prevention Week and Chris Heron projects, and sometime later this month, we are going to have our end of the year celebration. Next slide, please. And going a bit more into depth on the community event on April 10th, we hosted a community event in our commons at our school called Raising Voices, Saving Lives, where we talked about fentanyl. We raised awareness about how fentanyl overdoses, how lethal they are, and how like hurtful it is to know how many people are dying from fentanyl. And so we had a very successful time there with over 150 participants, most of them being parents and students. And after the fact, we heard like health teachers at our school were saying how their students really learned a lot from that night, and parents also learned a lot from that night. And that's just kind of what we're trying to do, is not only spread wellness, but spread knowledge, because that's probably the biggest factor in saving people from drug overdoses.
Next slide, please.
So at the beginning of this event, everyone who was with us, which we partnered with LEAP, and we also had STUD come, and we all said, and I'm the reason why you are here, and highlighted ourselves and who we were and how we wanted to be here for the parents and for the students and for our community members. Next slide, please. So at this event, we had a lot of people who showed up. It was a lot of fun to be there and to learn a lot more. I always learn something new at these events. Me personally, I gave a personal story at the very beginning of the community forum where I talked about how I had lost my cousin to a fentanyl overdose when he was 19 years old. And I shared this story to show how fentanyl can impact everyone and that it's important for parents to talk to their kids while they still can. Next slide, please.
We really try to emphasize the importance of being prepared for anything in the future. In fact, our materials, Talk They Hear You, are we're encouraging parents to talk to their kids about drugs. In fact, the number one reason kids choose not to use drugs is because of their parents, and we have a lot of materials and pamphlets. We speak to a lot of parents, and we help them help their kids talk about drugs and being safe in that world.
Next slide, please.
So one of our main resources that we always get a lot of comments and feedback on is the 5 conversation goals packet. This packet's very simple in explaining what type of things you should be talking to your kids about and how you should be talking to your kids. So it's the first conversation goal is that parents need to show their disapproval for drugs and alcohol. And the second would be to show care for the child's mental and physical well-being. The third goal is parents should inform themselves on drugs and alcohol to be a reliable source of information, so then their kids don't choose unreliable sources when they are seeking drugs and alcohol. The fourth goal is that parents should show that they pay attention to their kids' social life and that they care. And then the fifth and final goal is to practice strategies to build your kids' ability to avoid peer pressure and not give in to drugs and alcohol.
Next slide, please. So in closing, I just want to reiterate how fortunate we really are to have the support of our school, our community, our city, the county, and the state, and nationally as well. That's what's made us successful over the past 30 plus years. And I think most importantly, our youth are so valuable. We use our youth in practically everything we do. We help them grow and develop the desire to give back to their community. And especially during this time after COVID, I know many of you are very, very aware that many of our youth and our adults are suffering from, the anxiety, the mental health component. And part of the reason why Tiger Turns the Tide has decided to really focus on the mental health and wellness is really what it does for our youth. And I see that this year has been tremendously successful. Our group has grown tremendously. We've got about 80 students on our roster, but we've got probably 30 to 40 that come to meetings, that participate, that want to be a part of this whole movement of mental health and wellness, drug and alcohol prevention. And so again, we are just thankful. Here are our website, again, our Facebook and Instagram addresses, and my name and email and phone number. And one motto that we've always had from the very beginning is that individually we are one drop, but together we are an ocean. So again, thank you so much for this opportunity.
Thank you.
Thank you.
And thank you, Connie, Brooke, and Mateo. We really appreciate that, and definitely demonstrating the power and impact that an ocean can have when we're all collaborating across the community. So thank you so much for sharing that with us. Now we're going to hear from our last speaker, another community, this time a community in Georgia that supports 4 counties, DeKalb, Upson, Macon, and Bibb. We're joined by Sandra Dean, Executive Director and Region 2 Project Coordinator, Tyreek Warren, Region 6 Project Coordinator, Carlina Talbert, Evaluator and Epidemiologist, and Kimberly Houston, who serves as Treasurer. So Sandra, why don't you tell us about Beyond the Bell in Georgia?
Thank you. First of all, again, we want to thank SAMHSA for this wonderful opportunity. We're a small nonprofit organization, and to do this means the world to us. A little history about Beyond the Bell. It was a dream of mine, and we began in early 2002 on a journey to help children and youth in a community where we live. We wanted to make sure that families were safe and healthy. Alcohol and drugs have become a problem in the community, and we wanted to do something about it. We are a 501c3 nonprofit organization, and we began doing after-school programs and summer enrichment programs, fortunately funded by the state of Georgia at that time. Of course, when we started, we had no money, we had no funding. We had space that was donated to us, and we were just grateful. So we eventually were able to go and get funding, and that was 22 years ago, and we're still getting funding, and we're grateful for it. As our program progressed, we realized, and after doing a detailed needs assessment, it revealed that our children needed more than help with homework after school. So we did a community needs assessment, and it shows that alcohol and drugs was on the rise in the communities, and that we needed to have programs and services in place to help prevent access and early onset of drugs and alcohol. Our funding has come from we were Drug-Free Communities grantee, Stop Act grantee. We have several contracts with the state of Georgia under the Department of Behavior, Health, and Developmental Disabilities. We do lots of fundraisers. We beg for donations and money and space to keep our programs going. And we are still going strong in 2022, working in several communities. The pictures that you're actually seeing now are some of the original youth that began at Beyond the Bell. And one of the goals that we had, we wanted to make sure that we exposed our children to everything that we possibly could. So from day one, we started out making sure that we did trips outside of the state of Georgia. So we've taken groups to Washington, D.C., Kennedy Space Center, New Orleans, just all places so that our children could actually see that there was something else other than just Georgia if they wanted to venture out. The picture that you're seeing in the lower right-hand corner, we also teach our children that you got to give back, and you got to give back to your community. So one of the projects that the youth developed was visiting the service members that were actually in the hospital, in the VA hospitals. So you see our youth there with one of the veterans at a local veterans hospital. The youth would collect money to actually purchase gifts to take, like socks, toiletries. They would shoot pool with them. They would sit down and talk with them and learn from what those service members had to tell them. So that's how we got our humble beginnings. And like I said, we're still around. Some of the youth that you're seeing now on this photo, they're now in their 20s. Most of them started with us when they were 5 years old, and now we have alumni that come back to help us every year. Next slide.
This is going to talk a little bit about the program and events that Beyond the Bell had. Beyond the Bell focuses mainly on health and safety of young people ages 9 to 20 and their parents. Beyond the Bell provides life skills training, health fairs, and other programs to ensure our youth live happy and safe lives, and use the tools we provide to enjoy these activities that exclude alcohol, marijuana, tobacco, and other drugs. We use evidence-based strategies to build skills and support the needs of our young people to reduce barriers to their success. The mission of Beyond the Bell is to provide resources and the focus in our focus communities to effectively provide prevention programs, effective interventions, and resources to reduce substance use in our youth. The picture you see at the top left corner, you see some of our kids attending a town hall meeting with a few of the police officers in DeKalb County, Georgia. The next picture in the lower left corner is a visit to the Kennedy Space Center. And on the lower right, you see some of the kids participating in one of the drug-free testing kit giveaways in DeKalb County at one of our health fairs here in Georgia. Next slide, please.
Beyond the Bell, with state and federal funding, began to provide evidence-based environmental and individual level strategies to address local issues. Data from our needs assessments indicated 2 strategies would greatly benefit our focus communities. The environmental strategy positive culture framework focuses on revealing and growing positive shared values and belief, which result in healthier and safer behaviors. This perspective does not mean that we ignore the minimize the negativity, harm, or risk that communities face. Using a positive culture framework strategy, we educate the community on the dangers of substance use and misuse by using billboards, Department of Motor Vehicle messages boards inside DMV offices, radio ads, TV ads, brochures, town hall meetings, focus groups, health fairs, collaborations with partner organizations. We collect surveys to assess community needs, pre and post surveys to determine if programs are working, as well as other tools necessary based on the communities we serve. Our agency evaluates the data prepared reports, and we put programs in place to address issues found in the results. Left picture is a picture of our original Beyond the Bell kids looking up to their future because they decided to say no to using alcohol and drugs. Next, we will hear from our evaluator, Carly Talbert, who recently graduated from Emory University.
Next slide.
She got to say over. All right.
So it's Carly next.
Oh, sorry, was muted. Okay, so I'm Carly, but I also go by Carlena. And so as the evaluator, I assess the survey responses. And so I use Qualtrics, and Qualtrics, you're able to create surveys in there, and then from there create reports that will kind of give you a summarization of the data. And so using visualization techniques such as like graphs and charts, I'm able to show like the demographics most affected by certain issues and their responses. And so this is essential to show the gap in the communities. And so using that data, we're able to show the gap, right? And so with that gap, we're able to then introduce a resource or program in the community to address the issue. And then also as a program evaluator, I also teach what we have called the Baldwin Life Skills Lessons, which we'll go over next in the next slide. I teach the lessons, I do a pre and post survey. And so using that survey, I'm able to assess the change in thinking, which determines if the program is effective in its mission.
On this particular slide, Bopkins Life Skills is our individual level strategy, and it had to be approved by the state of Georgia where we receive our funding. So we have virtually trained, we know 1,500 students in Bopkins since we've been around. And Bopkins Life Skills is a evidence-based strategy. We actually had to go to New York, White Plains, New York, to get certified to actually teach it. And it's proven to be effective when it's used properly. And it helps reduce tobacco, alcohol, and marijuana use. And it works with a diverse range of youth, no matter background. And that reduction in substance use is long lasting as long as it's taught with integrity and fidelity. And it works better when it's taught by teachers, prevention specialists, peer leaders, health professionals. We work in 24 schools in Macon-Bibb County, which is one of our communities, and we actually use certified school teachers to teach our program after school. And yes, they've been in school all day and they're tired, but they still work with Beyond the Bell to teach Botkin's life skills to make sure that our youth are getting the tools that they need to live successfully. And some of the topics that Botkin's cover and that we teach include self-image and self-improvement, making decisions, smoking myths and realities, alcohol and marijuana myths and realities, advertising, because our youth sometimes see a lot of advertising that looks glamorous, and we make sure that we teach them that they can't just go by advertising. We teach social skills, assertiveness, resolving conflict, communication skills, and coping with anger. We really enjoy teaching Botkin's because it's so comprehensive and it actually helps children. Actually, one of the schools that we were in Bibb County, I think the principal contacted me and said, is there a part 2 to this? Because the children got so much from it. And yes, there was a part 2. So we got the instructor to go back and do part 2 of Botkin's. It's really effective when it's taught the way that it's meant to be taught. So next slide.
We use 2 A's in our debrief tobacco intervention. In community settings, we ask the person or persons about tobacco use. We advise the person to quit if they use tobacco products. We feel the most important part to understand about tobacco is to know it is never too late to quit or ask for help. There are always resources available to help build skills for dealing with cravings, triggers, and stressful situations. There's even medication that can help you handle withdrawals and cravings and double your chances of quitting for good. We refer the person or persons to various resources to help them quit, such as the Quit Line, 800 Quit Now, or the National Cancer Institute. Also, we notice an increase in opioid usage. According to the Georgia Department of Public Health, between 2018 and 2022 in Macon-Bibb, one of our communities that we work in, there were 105 drug overdose deaths. 75% of those deaths involved opioids and 63.8% involved synthetic opioids other than methadone, such as fentanyl. The 2022 Macon-Bibb mortality rate is higher when compared to the state age-adjusted death rate of 18.6 per 100,000 and is the 3rd highest compared to the 13 counties in North Central Health District.
I would like to add here also that we have partnerships with 2 of the health districts in Georgia, and we do provide Narcan training, just like the first speaker. So our health partners provide the Narcan training for our community members and we were awarded recently an opioid grant from the state of Georgia also. And under that particular grant, we do town hall meetings to educate the community on the dangers of the opioid use in Macon-Bibb County. One of our town hall meetings, we had the coroner of Macon come to that particular town hall meetings, and during the week that we had that particular town hall meetings, he had seen 5 bodies that had overdosed. So it's pretty much out of control. We are providing Narcan kits under our grant. And like I said, we're providing the educational component for community members. Next slide.
So in addition to all of these, we were offered a statewide special population grant. Effective February 1st, 2023, Beyond the Bell utilized our experienced CPAW and coalition members in each of our current regions for a statewide contract to help develop an appropriate plan of action for senior citizens ages 65 and up. Our goal is to work with statewide program with the senior citizens, which are funded by the Department of Behavioral Health and Developmental Disabilities, to listen to and address the needs and concerns and fears, to provide for referrals and recommendations, including tobacco referrals and information as appropriate for their concerns. We discuss risk and protective factors and provide clear definitions of this information. We conducted a senior needs assessment and a tobacco survey during the initial meeting to determine what the needs were and discuss how many turned to tobacco and alcohol and other drugs for them to cope with some of the issues they're facing. We provide evidence-based practices and information from the National Institute of Health on drug abuse, which is published Substance Use in Older Adults Drugs Facts. We use data collected through the surveys during the initial meetings. We define appropriate environmental strategies and information needed for dissemination throughout the regions. Some of the programs we held to this day was our faith-based mental health workshops, senior citizen workshops, including music, talk about senior programs and services that are available to them. We also had the Alzheimer's and dementia resources, which was instructed by one of the registered nurses here in Georgia. We discussed what some of the protective and risk factors for senior citizens and the stressors that were identified was their voices were unseen and shadowed, the death of loved ones and depression, of course, COVID-19, chronic illness, and overall health in general. They also addressed their concerns for the current generation and their lack of knowledge and respect for them. Some of the seniors expressed the need for more informational meetings such as these and would like to see more workshops to address these issues regarding their bodies and the aging process as they're living with pain, and self-defense workshops, the proper process for prescription drug disposal, and the effects of alcohol and tobacco and marijuana. They were even concerned about how some of these prescription drugs affect their mind and their body, and also mixing some of these above drugs with the prescription drugs that they were prescribed. Some of the top questions that came out of our discussions with them were, how can safety be more improved for senior citizens? And how can they deal with loneliness and the fact that they have nothing to do now in their retirement years and getting sick while they're alone? And then also the cost of prescription drugs and the amount of prescription drugs that were prescribed to seniors. Here on this slide, you'll see some of the communities that we have worked in so far and some of the meetings that we hosted. Next slide, please.
On this particular slide, you will see the youth that spearheads our Talk They Hear campaign each year. So, of course, the Talk They Hear campaign aims to reduce underage drinking and other substance use among youth under the age of 21 by providing parents and caregivers with information and resources they need to address these issues with their children early and often. The campaign that we're actually working on now with our stipend that we receive for this year will be 3 parts. We're actually going to host a town hall meeting on opioids. We're going to have an outdoor community event where the health department, our partner, the health department will come and do screenings. They will test for diabetes, HIV testing, blood pressure. At this particular event, we're going to have food, fun for the children, make sure that we have all kind of brochures and information. Law enforcement will be there to answer any questions. And then our third event that we're hosting under the Talk They Hear campaign will be a focus group with our young people to sit around the table and speak with them after they've been through several Talk They Hear campaigns and kind of get a feeling of, okay, what do you think? What do we need to do differently? How do you feel now with so many things that's going on in the communities that's kind of getting on their brains? And a lot of kids are just kind of distressed and stressed about events that's happening. So we just kind of want to sit with them, listen to them, and find out what other resources they have. We have thoroughly enjoyed the stipends that we receive each year. Last year, we did an event with the local police department where over 300 people came to a park in one of our communities, a pavilion actually in one of our communities. And it was just a wonderful event. And this year we decided to kind of stretch it out as far as we could by having the 3 events under the umbrella of our Talk They Hear. Next slide. And to do everything that we actually do, we really rely on our logic model. Each year we update our logic model to ensure that we are following what we need to follow. We, of course, look at our inputs and what we're actually getting out, the risk and protective factors, where we want to be. Are we making an impact on our community? What does it take to get from risk factors to positive factors in the lives of young people? So we follow our logic model and submit it each year to the state for approval. And our intervening variables, basically under our logic model, which we have realized from our strategies, is social and community norms is an intervening variable. Social availability and perception of risk. Some of the contributing factors are cultural acceptability, lack of parental monitoring, provision to minors, and a lack of parental involvement. We talk with our parents because under Botkins, there is a parent resource also where we try to encourage the parents to make sure that they are monitoring their children, they are monitoring alcohol in their homes and making sure that it's kept out of the way for children to get into. There are some risk factors involved, low level of monitoring or supervision, because some parents will say, well, my children won't touch that, or my children won't do this. But we try to work with parents and let them know that children do take risk. And we tried, some of the risk factors are also easy availability of alcohol, marijuana, and tobacco. We work with law enforcement agencies in all of our communities to do compliance checks and to make sure that the convenience stores are not selling beer and tobacco to our children. We also monitor the stores to make sure that their parking lots are litter-free, to make sure that our communities are safe. In one of our communities, 23 stores sold to, during a compliance check with law enforcement, 23 stores sold to minors. The city council in that community immediately suspended their license for 30 days to make sure that they stopped that process. And some of the protective factors are involvement in healthy alcohol and drug-free activities, like the events that we talked about just a few minutes ago when we do our Talks They Listen campaign. It's alcohol and drug-free. We'll have fun, the children will have fun, we'll give our information, and then decrease access and social availability through education, increased prevention services. So there are some protective factors. However, there are some risk factors that we try to delve into to make sure that we put programs in place to address the risk factors. Next slide.
And last but not least, these are some of the challenges and some of the successes that we see that we're facing. Of course, some of the challenges include funding, parental support, donations of money, and donation of space to house some of our events, the dedication to the cause, fundraising, cost of doing business, even being a nonprofit, failure is to some of that don't see the need, and then not enough support or proactive prevention efforts, and not enough to prevent adolescent drug use and alcohol. And I think Ms. Dean wanted to elaborate as something happened recently here in Georgia.
So yes, actually last week here in Georgia, we had a 15-year-old to overdose and die in the classroom in one of the high schools. She was 15 years old. Her sister had called the school last Monday to tell the principal that she thought that her sister was actually purchasing pills from someone at the school, but nothing was done. The next day, Tuesday, the student actually died in the classroom. Of course, we then got overwhelmed with phone calls from schools. The local media contacted us, and we went on live television to kind of talk about what parents can do to get their children in programs before it's too late. And now we have schools that we wanted to get in for prevention that's asking us, can you please come and do some prevention programs? So we really need proactive. We need the schools and the communities to be more proactive, because we don't know that that child could have been saved, but it's very possible that if it had been talked about earlier and someone had been more aware, then perhaps she could have been saved. But she was 15 years old and actually died in the classroom among her classmates. And of course, that was so hard for the other children in the classroom to actually witness that. So that's one of the challenges that we have, is ensuring that parents and schools are proactive.
Right, and lastly, some of the successes that we see with our programs. The youth successes, such as 100% high school graduation rate and approximately 80% of our students' college graduation. They have success, a lot of our alumni have successful careers now. We haven't seen any jail or incarcerations of our alumni. The program has been in business for over 20 years, which is awesome. Wonderful partnerships we've created and met with along the way. Program recognition, alumni continued support of programs, and children are taught to have pride in their community. And with that, some of the pictures here, you see the kids cleaning up our DeKalb County area. And we'll reward them. And they had a fun trip. At the lower left-hand side of the screen, you'll see them loading the bus to go on a trip in Atlanta to see the Atlanta Hawks. So we're just really appreciative of all the programs that we're able to sponsor and make a difference in these children's lives.
Next slide,
Next
please.
slide.
Okay, so I know there was definitely a lot of information that we guys gave you, and we only were able to provide you guys for 20 minutes total. But if there's any additional information that you want to know, any questions, comments, concerns, you can reach us at our email at beyondthebell@comcast.net, as well as our phone number at 404-374-8624. And if you want more information than that with all three of our communities, as far as Upson, Rockdale County, and Bibb, Macon and Bibb, you can reach us at our website, beyondthebellkids.org. Thank you.
Thank you.
Thank you.
Thank you. Wow, what a powerful presentation. What incredible work that you're doing in your communities in Georgia. Thank you so much for being here and sharing some of the heartbreaking challenges, but also some of the great successes too. So inspiring. And I know that there's been a lot of conversation in the chat of people really excited about some of the resources that our community speakers shared. I encourage you to reach out to them using their contact information that they shared during the presentation to request that information. This presentation was recorded, and SAMHSA will be making it available on their YouTube channel in a few weeks, so that if you have colleagues that you'd like to share the information with, you'll be able to share the link to that video. We have a few minutes for some questions that have been shared during all of our presentations. First, I'd like to go to Talia in California. And there was a lot of interest about the wheel that you talked about that you had displayed at your booth. And one of the questions was, could you share some of the questions that you had as part of that wheel, just that were like used to have discussion with the students?
Yes, I'd be happy to. I can drop a PDF of it into the chat if that's okay with all of you. But for example, you know, one of the questions is, does using prescription stimulants make me perform better on my, schoolwork? And so we actually refer to some data that show that if you don't have ADHD and you use prescription stimulants like Adderall, you don't perform better in school. And students are often surprised to hear that. You stay awake and you get the work done, but it's not necessarily a better. It also allows us to talk about counterfeit pills. Another one is about just general information about cannabis, marijuana, and just how the potency has increased, how the various ways that it's utilized could affect you differently. An edible takes longer to kick in, and so you might overshoot the runway and take more, have another gummy, and then you run into trouble later and it lasts longer. Vaping with the extracts being much higher potency than smoking, for example. And so it's just information that students don't know. And again, we tell them it's better if you don't use, but if you're going to use, it's best to have the information to use more safely. And I see requests for the PDF, so I will drop that into the chat.
Okay, great. Thank you so much. Our next question are for our colleagues at Tiger Turns the Tide in Oregon. So Connie, Brooke, and Mateo, there was a lot of interest to hear more about the 5 conversation goals that you were sharing about ways to talking with teens about alcohol and other drugs. Could you say a little bit more about what those 5 conversation goals are?
Sure. Mateo and Brooke unfortunately had to go back to class. But what they were referring to is that little brochure was one of the most popular brochures that were distributed at our Raising Voices Saving Lives. And so we had done an evaluation form, and we had about 4 or 5 different parents respond to that being helpful, because I think the one thing that parents were looking for, the feeling that I got, is how to start a conversation. How do I talk to my teen about drug and alcohol use? And that little pamphlet explains it. And I know that it is available through Talk They Hear You, our Communities Talk. That's where we receive our materials. And so again, that's why they felt that they wanted to highlight that particularly.
Great, thank you so much. And it looks like someone has added to the chat that Talk They Hear You conversation goal resource. So make sure to check that out. And always know that you can go to the SAMHSA store to find all of the variety of resources that SAMHSA has available. I know earlier in the chats, there was a lot of interest in some of the resources around marijuana. SAMHSA has a fantastic series called Tips for Teens that focuses on different substances, including marijuana. And so if you visit the SAMHSA store, you can find all of those resources to download and use and share in your communities. Our last question is for our colleagues at Beyond the Bell in Georgia. There was a lot of interest in the Botvin life skills teaching that you showcased. And Carlina, I was wondering if you could share a little bit about where people could find more resources on that initiative, and any tips or recommendations you have for how you've been using it.
Yes, actually, we have been using Botkins for probably 7 or 8 years. Like I said, we did go to the training in White Plains, New York, which they offer maybe a couple of times a year. But we utilize pre and post tests before starting a Botkins class. The pre-tests kind of tell us what the youth know. And then, of course, the post-test measures what they learned during the course. We do a 6-week class. Botkins recommend 50 minutes to 1 hour, 1 day per week. And it's taught, and it should be taught the way the curriculum tells you to teach it. And if you actually teach it that way and make sure that the children are engaged, because that's one of the requirements of Botkins, is that the youth are engaged in the classes, then they will get a lot out of it. We highly recommend Botkins. We started out with another curriculum before Botkins, and it just didn't fit what we needed, but Botkins certainly does. But the pre and post test, in our opinions, are key to administering Botkins life skills.
Great, thank you so much, Sandra. So helpful.
Yeah, and I was just gonna say, like, in the way way we kind of got them to be more involved, it's just more incentives. I feel that the modern learner kind of needs more of like an interactive interface of learning. And so one thing, it'll start off with the PowerPoint, and then, you know, throughout the PowerPoint, we'll ask a question, you raise your hand, you get the question right, you know, here's a piece of candy. It's like basically a big bowl of like a bunch of different candies that we get to pick from. And then if I ask a question that's more open-ended, you know, we talk through the answer with the class listening. And so like a lot of kids love it. They raise their hands. They want to read the PowerPoint slides with you, honestly, for you. They make it really easy. And then at the very end, there's a Kahoot game that is used to assess their knowledge. And so, of course, first, second, third place, first and second place to get a gift card. And so they get really competitive. And some go, oh, well, this person won last week. But it's really interesting because they actually want to like win. So they ended up learning without realizing it.
Amazing. Well, thank you, everyone. Thank you to all the speakers who participated and for the audience for your great questions. And with that, I'm going to turn it over to Sarah Potter.
And I just get the pleasure of thanking our speakers for their contributions and sharing their knowledge and information with all of us. And to all of you who tuned in and stayed for the duration of the webinar. Let's keep this excitement going throughout the week. This week, I share it in the chat. Please update your socials and hashtag National Prevention Week 24 and hashtag My Prevention Story this week. Share those on your socials with your photos and good news of prevention. And preview on Friday, May 17th, we are releasing a brand new video that pays tribute to prevention organizations across the country. So look at our YouTube page for that and share that on Friday. Thank you to everyone. Great to see you all, and have a great week.